Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and I have a very special guest today, Dr. Regina Koepp with the Center for Mental Health and Aging. And welcome, Dr. Koepp. I'm super excited to have you on today.
Thank you. I'm delighted to be here.
And so a lot of people have parents that call a lot. One of my team members has a sister that calls a lot all day long for everything, and so she's going to enjoy this probably more than some of my people that watch the podcast, because this is like really huge. And so today we're going to be talking about the elderly parent calling multiple times a day, which in hers it could be a sibling or someone else. And so when you're having a client that's coming to you and they're saying, hey, they're calling all the time, things like that, what are the signs that, that a parent may need more help, than they realize, or maybe that they're asking for? And so they just think they're being obnoxious and, calling all the time for no apparent reason.
Yeah, it's such a good question. First, I think it's important to recognize the relationship. So people call people they trust, right? So if your older loved one is calling you all day, or if it's a sibling or a parent or a spouse, an ex-spouse, I've worked with a lot of ex-spouses who are in a caregiver role, and their loved one is calling all throughout the day and it's new, I would one, acknowledge that this is an important relationship, and then two, get curious about where this change is coming from. And sometimes that change is coming from some very important medical issue or mental health issue or loneliness or sense of isolation. And so the first thing I would do is to say, get curious. And it can be incredibly frustrating because it can throw you off course. And I actually have a few recommendations. And so the first is curiosity. So what's driving this behavior? And inquire and ask your loved one, what's going on just before you call me? What's going on in your day? Tell me about how you're spending your days. And a lot of loved ones are already having these conversations with the older loved one. And so it might just be natural, like, why all of a sudden are you calling me so often? What's going on with you? How are things going in your life? You could ask how they feel just before they call you and get a sense, is this anxiety? Is this a sense of loneliness? Is this fear, paranoia? Sometimes with dementia disorders, there are some changes that can be like this because a sense of loss of self-confidence. Like, I don't trust my brain like I used to, and I just need a little checks and balances. And so I would encourage you to get really curious about where this behavior is coming from. If you're concerned about this behavior, like the person is paranoid, and that's very unusual, then I would definitely reach out to a medical provider pretty immediately to get the situation assessed. If it's a sense of loneliness or there's a loss or a recent change, like sometimes moving into a new environment, everything's unfamiliar, might spark this. Sometimes losses of friends in the community, like death of friends and community members, can trigger something that the older person is reaching out for support or soothing around. Sometimes loneliness, right? Like, I just want to talk to somebody. And so the first is to get very curious. And then I have some other ideas of how to address it going forward too, but I'll stop here. Just
Well, that's great though, because when you're thinking about this, it's like with my grandmother, she didn't have dementia, but she expected me to call her every day. So, and if I didn't call, the next day she called and said, why didn't you call? So I always laughingly told her the phone did work both ways, so
she could call you.
Yeah, so, but for those that are listening that have that parent or that sibling or that spouse or even ex-spouse that's doing that kind of stuff. What kind of tips do you have that kind of help them get through it, make it less traumatic? Because I've seen people, it becomes very stressful for that caregiver, child or spouse or something, to be in the middle of doing something and the phone rings, in the middle of doing something and the phone rings. And so what kind of things do you offer tip-wise that can help someone that has that issue?
Yeah. So one, you get very curious and you inquire where this change is coming from. Two is you invite that older adult into a conversation about what's going on. So it's not, and I would invite you, if your older loved one is capable, to solve this problem as a team. It's not just you solving the problem. This is a relational issue. So the relationship needs to respond to the problem. If it's a problem, some people it's not a problem for, but for the people who it is, you rely on the relationship to shift and change the problem. So you could ask your loved one, what's happening just before you call me? Are you feeling lonely? So all those curiosity questions, and then invite them into a discussion. As I said, your loved one is calling you because they rely on you, they trust you, they enjoy you and your time. I will also say older adults, a common sentiment of older adults is, especially when they're asking for more assistance from loved ones, is that they fear being a burden. And so the more annoyed they get the sense that you are, the more that confirms the fear that they might be, quote, a burden. And that adds a lot of strain on both the older adult and the caregiver. And so the more you can invite the older adult into a conversation compassionately and honestly, so the healthier, this solution will be. The challenge with certain conditions that might not be possible, like with dementia disorders, depending on the stage of the dementia disorder, it might not be possible to problem solve this with your loved one. Or if there are strong personality concerns, right? Maybe between you and your loved one, maybe you've always butted heads, maybe you've never had a healthy interaction. Then it might not be possible to rely on the relationship because that's your style of communicating. You might have to try other approaches. But as much as you can, work together to solve the problem. What this does is it builds trust between you and your loved one, and it also helps to pave the road for other difficult conversations that you're going to be having down the road, because this is not the first, this won't be the last issue that you and your loved one are going to be working through. This is one of many issues that you and your loved one are going to be conversing about and negotiating and problem solving. So as much as you can, invite your loved one into the conversation about how to respond. So as you're talking, and this is why being a detective is helpful, or being curious is helpful, like, is this out of loneliness, or is this out of a medical change or a significant mental health change? If it's loneliness, you can brainstorm other options. If it's a significant medical or mental health change, you need professional help. And so you need to get them professional help, and then sometimes medication, sometimes hydration, sometimes whatever the issue is needs to get corrected. So you can also, if your loved one is capable and doesn't need immediate medical or mental health attention, connect them or brainstorm who else in your loved one's life could they connect with. And maybe they're old friends and family that they haven't talked to in a while. This one of the bright spots of COVID, and there aren't many, but it was a lot of people were talking about how they connected with long time ago friends, like friends that they grew up with in childhood, or like for me, for example, I reconnected with two of my high school / college friends. So those are like 25, 30-year-old relationships. And we hadn't talked for years, and then we reconnected during COVID. And but a lot of my older clients were talking about that as well. And so identifying people who would be willing to reach out to your older loved one, maybe just give your older loved one a call, so not all of the daily conversation is on your shoulders, but kind of spreading the wealth, maybe old high school friends. Asking, there are some senior care groups that do some outreach to older adults. You could connect with them. And then you could brainstorm activities with your loved one, like What did you used to do that you've given up in the last year or so? What could I help you get engaged with again? I had a client who was a woodworker, and he would like whittle little figurines. And he was so good at it that he became a mentor to other figurine whittlers and out of wood. And so what could you do, or what could you help your loved one do that might reinvigorate some activity and interest, sense of accomplishment and purpose? We all need a sense of purpose in our lives. And imagine just sitting home alone without much to do or many to talk to, how lonely and lacking of meaning and lacking of purpose that just kind of feels like, right? We all have a human need to contribute, and especially in older adulthood, a sense of contribution is really, and legacy is really important. So how can you brainstorm with your loved one ways to capture that?
So in my office, we have clients, they come in and they'll say, oh, my parents need to be doing this, and how do I have that conversation, and so, for estate planning, it's pretty easy. I said, you just go home and brag about how good you feel for getting yours done, and so, and we try to talk to them about different ways, because sometimes the direct approach is not always the best approach, but when you're having difficult conversations, whether they need planning, or whether can they stay at home by themselves, or whether we need to move them. How do you help people deal with those difficult conversations when they have aging parents?
Yeah, like you said, you see one relationship, you've seen one relationship. Every relationship has their own dynamics. I do have one final tip, and then I'll jump into there. About the calling all day long is to manage expectations. So if you know that your loved one is calling you 10 times a day and it's interrupting your work and it's not sustainable for you, one option is to say to your loved one, I will call you at 8 a.m., at noon, and 5 p.m. You tell your loved one the times that you'll call and remind them that you'll call at that time. It doesn't have to be 3 times a day, but you get the idea. You set the time. So what that does is it tells your loved one, okay, it's important that we talk. I hear you that it's important that we talk. But we also have to acknowledge my needs as a person working, whatever. A lot of people are in the sandwich with little kids and aging parents, and right, or I work full time and have little kids and all of that. So tell them the times that you will call and be true to your word. So do something that you can, give time frames that you can accommodate, and then let them know that you will call them, and then call them and check in. And then call again and check in, or you two decide if you don't need to call at 5 p.m., for example. So that is really important, because what it does is it tells your loved one you're not rejecting them or abandoning them. You're going to be there, but you also have your own needs to manage as well. And so that might be a negotiation kind of strategy to just manage the expectations. I'll call you at these time points. And what's really important is caregivers, and we're going to get into this in the next question, which is how to actually have these conversations. It's hard to know what your own boundaries are in each situation, because these might be new situations and you might never have had to identify your own boundaries around this. My own boundaries with my time. I can call you at these 3 time points, but not at 2 p.m. because I'm seeing clients, right? So taking the time to identify your own needs and boundaries as a caregiver is really important. And acknowledging your older loved one's needs and wishes is really important too. And trying to find, this is really hard, but trying to find a balance between the two, or an integration of the two. And that's easier said than done. It takes a lot of practice and a lot of failure, and then a lot of regrouping and learning and trying again. And it's really helpful for your caregiving relationship as a whole. As I said earlier, this is one of many conversations down the road. And the earlier you can start practicing negotiating your boundaries with your loved one's needs and wishes, the better. So, yeah.
Sorry, do you find that there's certain types of diagnosis that creates this more than others? or does it really seem to matter?
People who have more anxiety or fear-based kind of conditions might call more. Sometimes people with a cognitive disorder who are losing a sense of self and self-confidence might call more, like as checking in. Definitely fear-based kind of mental health conditions, like a significant anxiety disorder, dementia with anxiety or depression. So that's important to know, or that's important just to be mindful of as you're checking in, to think about what other, the first step is to get curious. Do I need to get my loved one care, or is this a loneliness, isolation issue that I can help brainstorm? Maybe it's a loneliness, isolation issue that is resulting in depression, and you do need to get your loved one care. And depression's highly treatable, anxiety is highly treatable, even in the context of dementia. So it's important that you get care for your loved one.
Go ahead, I'm waiting.
Okay. I was going to just respond to your difficulty, like the difficult conversations. Were you going to ask something else?
Nope, go ahead.
Yes. So the difficult conversation, what can also happen is a situation that's pretty common in caregiving and the caregiver's sort of journey, which is sometimes my loved one needs me and sometimes they don't. And sometimes they need me and sometimes they don't. And I call this the ambiguous caregiver stage, because you don't quite know, am I a caregiver, or does my loved one need me? Are they safe? Are they okay? What's the condition underlying this behavioral change? And that I call the ambiguous caregiver stage. And this is one of the most complicated stages for families. And like you were asking, so how do families have these conversations? And it's really, really complicated, because in this stage, the older adult probably has the majority of their capacity. So capacity meaning like they have the capacity to make decisions about their life and health and welfare and money, where their money goes, and driving. But there might be changes happening, like calling you all day long, or slips in the road, like driving, or maybe they forgot to pay bills one month. So there are these subtle changes that don't really amount to the person losing full capacity, but are like you're scratching your head. Is this dementia? Is this depression? Is this just their personality acting up? And so how much do I step in? How much do I not step in? And this ambiguous stage is really complicated. What I would say to families is to pay attention to that. One, that these might indeed be markers of illness that need formal professional evaluation. So really pay attention. And the hardest discussion often is, you need to go see someone, and the parent says, no, I'm not going to see someone just because you want me to. And so that's a tough one. Or you need to stop driving, or you need to stop managing your money, or I need to help you with this. No older adult enjoys hearing that. So this is very challenging, because this is very ambiguous. The older adult has been independent for so long, you're independent also, and you might be butting heads. And the best thing here in these ambiguous situations is, in my opinion, to get professional support in helping to clarify what's going on. If it's a dementia disorder, there's going to be a set of sort of a roadmap to help you navigate these things, because you'll have greater clarity around the health condition, dementia being the health condition. You'll have greater clarity on what the course of that illness, that dementia illness, looks like, and can plan accordingly. If it's a mental health condition, there's great treatment for mental health conditions, for depression, anxiety. And what's great about that is the earlier we can treat mental health conditions, the lower the risk for dementia. So you really want to help your loved one if it's ambiguous and you're not sure, should I step in and help? Should I not? Should I back up? I don't want to push them away, but I don't want them to get harmed. What can I do here? So if you're already in that place, get professional support, assessment, and information. So then you can figure out, what can your loved one do safely versus you stepping in to help? when do you need to bolster them rather than take over something?
So, having said that, and so how does someone find you?
So to find me, so what's
Mhm.
really exciting is I actually started the Center for Mental Health and Aging, which is an online platform. And my goal is to build a provider directory of mental health providers in the nation. So it's mental health providers like therapists, but also neuropsychologists, who are the people, in addition to neurologists, who diagnose dementia disorders. And when it's really complicated, who can see or identify, is this dementia or is it depression? Which is sometimes really hard to figure out for clinicians, just the basic clinician. So they can identify, is this Lewy body dementia or is this vascular dementia? And so neuropsychologists are really important in helping to identify the dementia disorder. So the provider directory has therapists, neuropsychologists, and psychiatrists, all who specialize with older adults.
And so, well, that's awesome because, we talk a lot about you've got to have the correct diagnosis, not just a global, oh, you have dementia. You really need to know what kind of dementia you have so you know how to treat it and what to do and what to expect. And so that's fabulous. And so, is there, I see your email is Regina at cmhaging.com.
Yes,
And
it's
is there a phone number, Regina?
No, the best way to reach us is through at the Center for Mental Health, which is mentalhealthandaging.com, or Regina at CMH which is the Center for Mental Health and Aging.com.
And so we talked a little earlier, and if they go to the website, they can access your podcast from there, correct?
Yes, yeah. So I have a podcast called The Psychology of Aging, and it's a combination of me providing information about mental health and aging and also interviewing experts in the field of mental health and aging. Sometimes I interview older adults and people with lived experience. So I have interviewed Chrissy Thelker, who's living with vascular dementia this week. I interviewed Angie Burke, who is living with neuro challenges post-stroke, and had a significant depression following stroke and requiring hospitalization. And then she worked on her mental health and became a bodybuilder and is now a bodybuilder and doing
Awesome.
great. Yeah. And she's a nurse educator, or she's an educator. She's a former nurse, but she's an educator in a stroke unit now. And yeah, and in a couple of weeks, I'll also have somebody who is a peer specialist in mental health. He's an older adult himself who's lived with mental health and substance use issues and now is supporting other older adults with the same. And then experts in the field as well, talking about aducanumab, I can never say that word well, for Alzheimer's and other sorts of hot topics in mental health.
No, we look forward to listening to that. And so I just want to thank you for being on the show today, and we look forward to having you on again in the future.
Yeah, thanks so much for having me and talking about this important topic with relationships. I will say the sooner you can start these conversations with love and compassion and empathy for yourself and your loved one, the better.
I totally agree.
Great.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.